Good morning and welcome to today's technical JCVI briefing from number 9 Downing Street. I'm Jonathan Van Tam, Deputy Chief Medical Officer for England. As is now custom and practice, I'm joined on my left by Dr. June Rain, Chief Exec of the MHRA, and to my right, Professor Wei-Shen Lim, who is the Chair of the Covid-19 Vaccine Subcommittee of the JCVI. Thanks all for joining. It remains nice to see people in person rather than down the camera. Today's briefing is about the UK booster programme. We won't be taking questions on other subjects. We'll be sticking to the technical detail of the booster briefing. I'll make a few opening remarks and then I shall pass to my colleagues. So I think I'd begin by reminding people that the UK has had one of the most successful COVID-19 vaccine programmes in the whole world. We've already seen the vaccines having a major impact on infections, but an even bigger impact on hospitalisations and deaths. And our latest estimates are that since we began deploying these vaccines, they've probably averted in the region of 24 million cases of COVID-19 in the UK and averted around 112,000 deaths. So incredibly successful to date and remains so. But we also know that this pandemic is still active. We are not past the pandemic. We're in an active phase still. We know that this winter could quite possibly be bumpy at times, and we know that other respiratory viruses such as flu and RSV are highly likely to make their returns. So with all of that in mind, the name of the game, the mantra if you like, is to stay on top of things. And that is why we asked JCVI to begin thinking and framing its thoughts around the booster programme back in the summer, and why the JCVI gave us some interim advice on the 30th of June. That set the direction of travel, but at the time it was too soon to boost people and there were not enough data to understand how, when and with what that might need to occur. But it set the direction of travel, and most importantly, it framed the possibility of a booster programme for NHS England and for the Vaccine Task Force, who have been working really incredibly hard behind the scenes to prepare extensively for both the supply and the potential deployment of boosters if that moment came. So today is the time to clarify that announcement, to clarify the advice that I can confirm has now gone to ministers, and we await the response. The technical component of the briefing is divided into two parts. The first will be delivered by Dr. Rain from the MHRA in relation to the licensure for COVID-19 booster vaccines, and then I will turn to Professor Lim for the detail of the recommendations themselves. Dr. Rain.